a decade, Dr. June Chin lived and practiced medicine in California, a state with legalized medical cannabis since 1996. California's integrative osteopathic clinic is focused on children with intractable epilepsy, cancer, and autism. She has seen firsthand how much medical cannabis can benefit patients. She is now currently treating both children and adults in New York and Connecticut. Dr. Chin is a chronic pain survivor. Doctors suggested opiate pain medications, steroids, epidurals, and ultimately surgery to fuse the spine. As a result of her experience, Dr. Chin decided to dedicate her medical career in finding effective, integrative, and holistic approaches to patient care. Dr. Chin is a frequent keynote speaker on the science and medicine of cannabis and has spoken at hospitals, conferences, and events all over the world.
You were diagnosed with ankylosing spondylitis, AS. Hope I said that properly.
Pretty good. Ankylosing spondylitis, or AS is just easier.
Yeah, AS. At the age of 17. Can you tell us about this diagnosis and how it affects you?
Sure. So, really, it just started with just a little bit of back pain, and then the pain grew and grew. I had a hard time getting out of bed in the morning. I had stiffness, in really all my joints. So it wasn't just my spine, and my parents were really worried, and they thought, well, teenagers really shouldn't have this much pain. She's having trouble walking, or she's not moving. She's in bed all day, so they started to get really worried. So I went, did a lot of tests, blood tests. We did imaging. And this is after having tried, of course, all sorts of medication from muscle relaxants. I did acupuncture. I did herbs, and nothing really worked. And finally, when I was diagnosed with AS, they basically said, well, this is a debilitating disease. It's basically an autoimmune disease of your spine. Your spine will start to fuse. So those bones that rotate and twist and side bend won't do that anymore. It'll start to, like, it almost crazy glues together. So you'll lose mobility. And over time, you'll just be on, pain medication, opiates.
Right.
So that's really, it was a bleak, a bleak prognosis.
Yeah, absolutely. And so now, clearly, through your journey and then now as an adult, how do you treat your AS, or is it, kind of the same with, more acupuncture? Obviously, you and your husband are osteopaths, so you can work on yourselves. But yeah, so how do you now treat it? Medical cannabis, which we'll get into.
Yeah. Yeah. So I basically maintain it. There's no cure, and I know that. When I was younger, I used to just wish there was no pain, or dream of a day that, I'd press on my back and press on my joints, and I said, I just wish, it would be more mobile, right? I would have more mobility. But now I realize that I won't be 100%, but that's okay, as long as I can maintain it and still live a decent quality of life. So I do a lot of different things. I do osteopathy, as you're familiar with, body work. I get rolfing. I go and get into my hot sauna. So I do hot yoga in there. And I take prescription medications as well. Celebrex is one of my go-tos. If I'm really, really in a lot of pain, I'll do Celebrex. Sometimes I'll do Flexeril, which is a muscle relaxant. But I only use that for when it really gets really, really bad. Mm-hmm. For the most part, I do natural supplements. So I'll always have like magnesium on hand. I'll have an anti-inflammatory such as turmeric, fish oils, and I do integrate medical cannabis. I don't take a lot of THC, which is the part of the cannabis plant that makes you high, because I actually don't like that feeling. So I do a lot of CBD combined with a little bit of THC. I have to see patients during the day, so I don't take anything that alters me during the day. But at night, I usually do what's called a 1-to-1, which is like a CBD THC combination, and I'll take it before bed. But since I've been doing this for so long, maybe I just take cannabis twice a week, really.
Oh,
It's
wow.
usually towards like Thursday, Friday after a long week if my pain is really bad.
Right. Yeah, no, CBD it's amazing. I actually, I have epilepsy. I've been seizure free for 8 years, or maybe just
Awesome.
9 years. I don't even know. Thank you. But I mean, I take Lamictal, so
Mm-hmm.
prescription drug, and there's no side effects, and anyways, it works very well for me. And clearly, I mean, my seizures were mild, only had 3, but still. And I see Oren Davinsky, who I'm sure you
Oh,
know.
yes.
Yes.
Yes, we work on a lot of patients together.
Oh, you do? Okay, so there you
Mhm.
go. Well, and the only reason I'm bringing this up, because obviously cannabis is used to treat epilepsy.
Yeah, yeah,
So
he's really big on it.
yeah, no, he's lovely. How did you decide to get into medical cannabis as a way to, well, treat yourself, but I guess more specifically, to treat your patients that come in with, a variety of, different symptoms and diagnoses?
Well, I was just at the right place at the right time. For me, I didn't try cannabis growing up. I didn't experiment with it during my teenage years. I was pre-med, and I grew up in a very traditional Chinese household. So my parents bought into reefer madness. They always taught me that if I used cannabis or any other drugs, I would eventually develop schizophrenia. So I didn't really experiment much with it. But by the time I got to med school, I went to med school on the West Coast in San Francisco. And San Francisco, California legalized cannabis over 20 years ago.
Mm-hmm.
So when I started medical school, they were just underway for their medical marijuana program.
Mm-hmm.
And I was working with an HIV and AIDS physician, and he saw that I had a hard time moving around all the time. He saw that I would wear this back brace, so he'd see the back brace under, on top of my scrubs, and he'd see that I'm always adjusting and I had to sit down all the time, or I'd walk with a limp. And he said, what's going on? You look like you're in a lot of pain. And I said, I have AS. And he goes, oh, you're not going to finish medical school. He says, I see you all the time. You're like sitting, you look miserable. He says, you have a long way to go. And I told him how frustrated I was. I said, here I am. I'm studying to be a doctor. I have access to tons of physicians. I have access to tons of specialists, but no one could really help me for AS. There's no cure. And he was the one that offered me medical cannabis. He gave it to me in a bottle, and he said, listen, this is what my HIV and AIDS patients use. He says, don't tell anyone. He wasn't like, don't advertise it, but it really works. And you should consider taking it, on a weekend that you're not on call, when you're not working, and let me know how you feel. And it sat on my dresser for weeks on end because I was really torn. I said, oh my gosh, like, number one, what this guy's doing, is it compromising my ability to finish school? Is he shady? But I know he's really well known. I mean, it was back and forth, and I finally decided to try it because I was in a lot of pain. And when I did, surprisingly, it worked. Surprisingly, I didn't feel incredibly high, but I remember feeling buzzed. It felt like I had my first glass of wine. It was a little bit buzzy, and I was a little happy. But by the next morning when I woke up, I had more mobility. Normally when I wake up in the morning, it's a slow moving process to get out of my bed, take a hot shower, do my stretches. Like I have this whole foam roller routine. I have this whole thing, and it was just easier to just get out of bed and get going. So I went back to him and I said, what the hell is in this thing? And he's like, oh, let me teach you about medical cannabis. And that is where it started. And that was like 20 years ago.
It's crazy, and there's been so many advancements, as you know, for
I know.
CBD, and it's really interesting because, and it's funny, obviously. I mean, obviously, I met you through GOPA, but obviously, patient confidentiality, like whatever. But it's funny because GOPA will bring, because obviously she's done work with CBD, like all these different things to our house as gifts and so forth. And I'm like very hesitant on trying them for some odd reason. I just, even though it's CBD and we'll get into it, versus the THC component, I don't know. I'm like, okay, I don't know. It's become such a, popular thing for all different things, not just, clearly for pain management. We'll get into that. So can you tell us about your book, which is Cannabis and CBD for Health and Wellness, an essential guide for using nature's medicine to relieve stress, anxiety, chronic pain, inflammation, and more, that you co-authored with Eliza Sherman?
Yeah, so we wrote a book 2019. Aliza and I wrote it together, and she's a wonderful woman. It's her 12th book. She comes from the tech industry, but how she stumbled on cannabis was through menopause and through terrible insomnia and pain. And so we have really great complementing stories because we're both mothers, we're both professionals, and there was always a stigma, with cannabis, as you can well imagine. And this book was really focused on anyone wanting to take a more integrative approach to their health and wellness. So, not just cannabis, but trying to understand how plant medicine works, why cannabis works, why it's illegal, why there are only few doctors that prescribe it. And then there are a lot of patient stories. I add patient stories in there, how I prescribe it, how I recommend it. So it's a really great book on cannabis, but also from a female's perspective.
Yeah, no, absolutely. I gotta go grab it and read it. So we talk about CBD and then there's the THC component. Can you just tell us, and we spoke a little bit about this, but can you tell us what the main difference between cannabidiol or CBD and then THC, because they're two different.
Yeah, those two molecules are the main players of the cannabis plant. So CBD and THC. You can think of them like a married couple. They work well together, but they're also a little bit antagonistic because CBD, anti-inflammatory, but does not make you feel high or euphoric. It's not very sedating unless you're taking higher doses. THC is what's well known for euphoria, sedation, and relaxation. It's what's really popular in the recreational market. So the combination of CBD and THC has very good therapeutic properties. They work both as an anti-inflammatory. So inflammation is the root cause of most diseases. They're great as anti-pain, anti-muscle spasm, anti-seizure, as well as appetite. It stimulates appetite and gets rid of nausea, and it helps with sleep. So you think, and I thought the same thing, like how can this one thing, CBD, THC, be so great for all these different ailments? But it's because we all have an endocannabinoid system in our body. So in our body, we make our own cannabinoid-like molecules, and CBD and THC amplifies our endocannabinoid system.
Incredible. But so, and I think a lot of people would have this question. I mean, obviously I mentioned it earlier, but is CBD quote unquote bad for the system?
Well,
I mean, somebody's, I don't do drugs. I mean, aside from my prescription drugs, I don't do drugs. I don't even drink alcohol, but that's a whole other thing. But, many people do, smoke marijuana, which obviously consists of the THC plant. Clearly that's not good for you. So, but just talking about CBD, is it bad for you in your system?
Well, so it really depends on what you're defining as bad. What are your goals for your health and wellness? CBD is an anti-inflammatory. So in that sense, if you have any symptoms that are causing you pain and inflammation, CBD is quite helpful. Some patients find CBD sedating. So there are a few patients that when they take it, they feel a little bit tired, they feel a little strange. Those are usually the same patients that feel tired when they take Advil or magnesium because they're really sensitive. But for the most part, CBD is safe, but you just have to be dosed properly. So you can't overtake it, overconsume it. If you overconsume it, sometimes it can affect your liver enzymes. And most importantly, if you're taking other medications. Like if I have patients that are taking Lamictal as well, and they're combining CBD, when they take high doses of CBD at the same time of their Lamictal, it can get in the way. And that's why I monitor blood levels, we monitor symptoms, we monitor seizure activity. So if you're using it for medicine, it's always important to talk to your healthcare provider about it. If you're using as a preventative, like a health and wellness over the counter, like CBD hemp, then you're taking smaller doses and you're taking it for, stiffness, for pain, for decreased anxiety, or for better sleep, like a vitamin.
Right. Okay. So then, as you're saying, you can take CBD in combination with medication. Um,
Yes,
okay.
yes.
No, it's well,
There's
obviously.
just certain medications that you need to watch out for. So there's like, I have patients with bipolar and depression, and they're on a couple of different medications. So we have to have that conversation, how it affects those medications, seizure medications,
Mhm.
blood thinners. So there are a couple of things that we need to watch out for.
Right. So when did you decide that you were going to expand your work and treat patients with CBD or medical cannabis? And so, like, I know there's a variety of conditions that obviously we talk about that treat it, but let's just say learning, for instance, ADHD. I know that's something that you treat. How does the cannabis work? So, like, for instance, with ADHD, hyperactivity, but then also attention. Um, so,
So yeah, so how I actually had, so my husband and I were in California. We had a special needs practice. So we had children and adults with special needs. That was probably about 85% of the practice. And these are kids with that came in with metabolic disorders, genetic disorders,
mhm,
brain injury during birth. It really ranged. And some of the children had seizures. Some of them were nonverbal, non-ambulatory, right? They were in a wheelchair or they couldn't speak. And it was actually a couple of the moms that told me they tried cannabis and it worked for the seizures, or they tried it
or
and physical therapy and OT noticed that, their cognitive functions were getting better or they were progressing with their therapy. And I thought, well, I know about medical cannabis because I've tried it. And so we started integrating it more and more in our practice. We didn't advertise it. I obviously didn't want to lose my license because I was still really unsure about the whole legality of it. Does malpractice cover you? What does it mean if insurance can't cover? How do I help the patients get medical cannabis? So there's all that liability. So it really early on, it was just word of mouth.
mhm.
And I made it a point to learn everything I could about medical cannabis, collect all my patient data, making sure that they're safe. And here I am, decades later.
It's incredible, and I should come see you in person, especially. So, what do you think are the most common misconceptions that people have in regards to cannabis, medical cannabis, and what are obviously, we spoke about, but what's the truth? You know, how can people kind of overcome these, misconceptions?
Well, I think the biggest misconception is that it cures everything. I mean, the way you read about it, it almost seems like it cures everything that moves, right? It
Mhm.
cures cancer, it's great for Parkinson's. And I look at cannabis as one thing in your toolbox.
Mhm.
It's one thing to help you live a healthier life,
Mhm.
but you need to, continue with the standard of care, which is could be prescription medications, could be working with your therapist, healthier eating, exercise. So it's one piece of the puzzle. I think that's the biggest misconception is when I have new patients come in, they take the cannabis for a week and then they're like, oh, it doesn't work.
Mhm.
And I said, no, you have to give it longer. It's not just going to be a 1 week thing.
Right.
And then they work with me over the course of a couple of months, and we graph everything out, and we take really good notes, and we track their progress, and then they can see it long term.
Right. And so now what's the different forms that medical cannabis comes in terms of in terms of pills, does it come in like a powder that you mix with, water or I don't know, some type of tea or whatever the case is? I know that there's a tea form, but that's probably completely separate. I mean, I don't know, but so so what type of, I guess, I don't know, whatever you want to say. Um, yeah, how does cannabis come? I mean, when you prescribe it to somebody,
So
like,
I'm in New York, and I'm located in Connecticut as well.
okay,
So every state has its own law, right?
okay,
So they sell certain types of cannabis, they sell certain potencies,
okay,
strengths of cannabis. So I can speak about Connecticut and New York now. They have flower, they have tinctures, which is basically an oil, a liquid form. They do have edibles, chocolates and gummies.
okay,
They have capsules, and they do have powder. that you mentioned. So powder that you put in your tea or your coffee or your juice. They have smokable forms in a vape pen as well. So it's pretty varied. I think both in in Connecticut and New York. In California, they have everything. I mean, California's medical program has been around for a long time. So, I mean, they have like inhalers with CBD, like a CBD, aerosolized nebulizer. That's what it's called, aerolized nebulizer. And they have all sorts of creative, like little, like, oh, it's called, those Listerine breath slips.
Yeah.
So there's this company called Kin Slips, and they have it. It comes a little thing. It's just like a little square, and you just put it under your tongue. It looks like those Listerine breath strips, and it's basically sublingual delivery, which means you put it under your tongue and you get the medicine pretty quickly.
That's amazing.
Everything. Yeah.
So now, like an oil or some chocolate? I've seen Scope has brought it over. Are those like effective from a medical standpoint? Like, is there like one, I'm saying mode, but like one oil or one, capsule, like which is the most effective, like for treatment, or it really doesn't matter, what type you take or what form it comes in?
It really depends on what your goal is.
Okay.
So that's what I always, when I have a patient come into my office, I do everything in the context of a full medical practice. So we're looking at full medical history, we're doing a physical exam, and if my patient says to me, I get panic attacks. I get terrible, debilitating panic attacks, and when it comes on, I need it to disappear right away. I can't drive, I can't function, I'm frozen in my tracks. That's when you need something fast acting. Fast acting comes in spray. Fast acting comes in inhaled form, like a vape or a flower. So that's what I recommend. Someone tells me I need it to last through the night. I have terrible insomnia and I keep waking up at 2 a.m., 3 a.m., 4 a.m. That's when I'll use a capsule, gel cap, or an edible, because that releases a little bit slower. And then the tincture, the oil form, basically works in between.
Okay. So there are, it depends on what the situation or the prognosis or the, whatever diagnosis or what, problem the client or the patient comes in. So with cannabis, is there like a specific population that it works better on, meaning like children versus adults, or is it kind of like anyone across the lifespan?
It's really individualized. It depends, because there's so many different formulations now. The great thing about the science of cannabis is they've broken down different molecules of the cannabinoids. So let's say I need something that's not so sedating because my patient works during the day. They're professors, they're lawyers, they're doctors, they're teachers, they're parents. So we can give them what's called like a daytime dose. A daytime dose doesn't create any sedation. Or kids, for me as a mom, I tell my children, you should not be using THC because it does affect brain function and brain development. So, and remember I told you we all have our own endocannabinoid system. So if you're flooding your body with outside cannabinoids, right, through the plant, your body's going to produce less. Your body's going to self-regulate. So it's better not to consume. But I do have teenagers with terrible ADHD. I have teenagers that have terrible anxiety that can't function, or even terrible pain, right? Or seizures. That's a different story. Then we can incorporate cannabinoids very safely. So it really depends case by case.
Right. No, I mean, and that really kind of makes sense because every person or patient is a unique case, regardless of whether it's the same diagnosis of epilepsy, ADHD, pain, anxiety, whatever, and so forth. So when should, I guess, a patient kind of retreat to cannabis or add cannabis into their medical treatment plan if they're on Western medication? Obviously they could talk to their doctors and like so forth, but kind of like what's the I guess the cutoff point versus exploring other, treatments and, medications and so forth if they're not working.
Yeah, so I think patients need to have that conversation with their health provider, and weigh the pros and cons. If prescription medications aren't working or other things aren't working, alternative medicine, if they've tried different integrative therapies from acupuncture to osteopathy, right? There's many different tools, and that hasn't worked, then having the conversation with the healthcare provider is good, because you might say, well, these pills aren't working. I'm sort of taking them, and I only see side effects. What more can we do? And that's when actually a lot of patients will call me, and I can talk to their healthcare provider. So I can sort of be the bridge and weigh the pros and cons. There's definitely patients that I say, you know what, no, you're not a candidate. There's some other things out there that will work way better, and really improve your quality of life. So it really depends on a case by case basis.
Again, case by case. So you're in Connecticut, you're in New York. There are obviously other osteopaths, but in terms of medical cannabis, and obviously doctors like Dr. Levinsky and so forth. But if someone is considering medical cannabis as an option, and I'm really kind of talking about those that are, not quote unquote in a metropolitan area, where should somebody start in addition to talking to their healthcare provider about finding providers that will administer medical cannabis?
Absolutely. That's a great question. There's over 30 states with medical cannabis laws now. I think 33 at
Yeah, isn't
last
there
count.
something that just came up on the news about New Jersey medical
New Jersey,
cannabis?
yeah, New Jersey
Yeah, or
went
something. I just
recreational.
saw it
Yeah,
a few days
New
ago.
Jersey went for adult use. But the main thing that I tell patients, and I have patients calling me from, Texas to Missouri to Georgia, not just the metropolitan areas, but
Right.
middle of the country, is to call their Department of Health or look at the Department of Health website. Because in the Department of Health website, if they have a medical cannabis program, they'll have a list of practitioners, and they'll have a list of regulated dispensaries. So these dispensaries are third-party tested. The products are third-party tested. The state has certain regulations and standards for these dispensaries, and these practitioners are licensed. So I think that's the first place to start.
Okay. And now, and people do this, I did this for Botox in the real beginning, for my arm, but can patients just say from California or other states, if they want to come to, New York and, see you and or your husband or whoever else, for medical cannabis, could they come and get it, or is it really they have to be kind of living in that state to get it? Because obviously there's a crossover and so forth. So
it depends on the state. So I
okay.
know for New York, you can be a temporary resident. So I have patients that, for example, I'll give you a prime example. This morning I saw someone that goes to Sloan Kettering for cancer treatments, but really lives in Texas. And she
Okay.
just flies back and forth. She has a place that she stays here through a friend. We put down that address. And it was fine. She was able to pick up medical cannabis, no problem. I know some other states, Connecticut might be different. I think with Connecticut, you have to establish residency, or get some sort of special permission through the Department of Health. But it really depends state by state.
Okay. So now cannabis is becoming, as we spoke about, morally widespread, increasingly in the US. Clearly it costs money, as any other type of medical treatment does. But so how are insurance companies now covering this type of treatment? Or is it more, out of pocket, as crazy as that may sound?
It's all out of pocket.
Yeah.
Yeah. So insurance company does not cover it because it's still federally regulated. So even though they're state by state medical cannabis programs, it's still federally illegal.
Right.
So that's why insurance companies don't cover it. So it's still out of pocket, unfortunately.
Right. And what is the cost of cannabis?
So it
Is
really
it
depends
range?
on how much you're using it, right? So let's go for epilepsy, for example. And this is a patient that was also a patient of NYU Langone Epilepsy Center. They tried Epidiolex, which is the FDA approved cannabis medicine, and it didn't work. So then we tried the New York cannabis program, and those products worked, but they needed a lot of it. This was a child with Dravet's, and so he was seizing probably at least 50 times a day. And gosh, mom and dad was spending about $3,500 a month just to keep up. So it was working. The seizures lessened, I mean, more than 50%, but it was just astronomical. And then I have my patient that has diabetes and she has leg pain. And she only spends about $150 a month, right? Because she uses it at night. It takes away the inflammation. So it really depends on how much you're using and what you're using it for. I
Okay.
hope with like New Jersey legalizing adult use,
Mhm.
I think more and more states will legalize and then the prices will come down.
Right. No, that would be great. Now, like with other states, is kind of the cost the same, or does it kind of depend upon what state you're living in?
It does. It depends on availability because remember, the cannabis has to be grown in that state.
Right.
So it depends on, supply and demand.
Right. No, of course. So, how have you seen, medical cannabis advance? You started, using medical cannabis, whatever, X number of years ago. And now we're in 2021. So, how have you seen the advancements? Because T form that was not done right.
No, they have CBD coffee, CBD wine. They have
Right.
infused beverages that are like, spritzers with juices. They have kombucha and CBD.
It's
So
crazy.
it's really becoming a mainstay for consumer product goods. I think more of that health and wellness, like we talked about, not just medicine.
Right.
And there's so much more studies, there's so much more studies that help us understand the pharmacokinetics, so how it's broken down in the body, what kind of receptors is it working. So I think the science and the regulation hasn't caught up with
Mhm.
each other, but it's nice to see everyone embracing it. And I think that's what's pushing the legalization through in state to state.
No, I think it's totally great. So, when would you suggest somebody to come see you? Obviously, it's your health provider. That's, a suggestion. But, if somebody's not seeing, a healthcare provider and they're thinking in terms of, this type of work and are thinking, oh, maybe I should try, X, Y, and Z and go and see Dr. Chin or your husband or whoever else, for medical cannabis, what would be kind of your advice to them?
Yeah, I mean, really, someone that wants a more integrative physician. So, not just cannabis, but learning the different things that they can incorporate
Mhm.
with their health and wellness. I think that's usually the person that comes to see me when they said, I've tried everything, doctor, and nothing really works, or I just don't feel like I live my life fully. I feel like things could be better.
Mhm.
That's when they usually give me a call. Sometimes patients will come just for education. Maybe they don't want a medical card. They
Mhm.
just want someone to talk to run some ideas by, like, I tried this medication. Should I add THC? Should I add CBD? What does this mean for my work?
Mhm.
If I get drug tested. So for me, I'm an advocate for my patient. I protect you. I'm here for you. I'm here if you want to bridge a conversation between your other specialists that might not be open
Right.
for medical cannabis and other things. So it's not just a card, it
Mhm.
really is everything that comes with a medical card. How does medical cannabis change your life, and how does it impact your family? How to have that conversation with your healthcare provider.
Right.
That's what
So
I'm
it's
here
really
for.
it's kind of a personal choice. And so
Hmm.
this is actually my last question. It could have been in a different order, but just came to me because I do have people that don't necessarily believe in
Hmm.
alternative therapy. But why do you think there are professionals that don't believe in alternative medicine?
Well, I think we're not taught what's called alternative medicine, quote unquote, in medical school, right?
Okay.
There's a lot to learn in medical school. There's only a certain amount of time. I mean, I got maybe 1 hour of nutrition
Oh,
out of
wow.
my, right, the whole course. Um, Osteopathic medical school is much more holistic. We do an extra year and a half to 2 years of anatomy.
Mhm.
But in general, Western medicine, allopathic medicine, the culture is deeply rooted in pharmaceuticals. So, and physicians are overworked. You know, you might spend 6 minutes with your doctor if you're lucky, and then like an hour in the waiting room.
No, it's true.
So
We
you
feel like
get, so prescriptions are quick. You have insomnia, here's a prescription. You have this, here's a prescription. I have side effects from this prescription. Okay, here's another prescription.
Mhm.
When you're looking at the future of medicine, I think and the future of plant medicine, cannabis medicine, this lends the conversation of true preventative health and wellness.
Mhm.
And you and allopathic medicine, that's just not the culture. But patients that dig deeper, that want more out of their health, will always turn to alternative or integrative medicine. And
Right.
it just because you go alternative, that doesn't mean it's one or, all or nothing.
Mhm.
You could be marrying both worlds and getting the best of both worlds, which
Mhm.
is, alternative plus conventional.
Yeah, absolutely. And I think a lot of people turn to alternative meds, I mean, including my mother, but because she suffers from rheumatoid arthritis.
Mm-hmm.
But for because they think that alternative meds, I mean, and it is true to a certain degree, obviously, that they don't like affect or have the side effects that traditional medications have. I mean, those are real.
Well, I would say they do have side effects, but the
Okay.
side effects are less because it usually comes in an herbal remedy formula or a natural supplement.
Mhm.
And when you're using something in a herbal remedy formula or plant-based, some sort of a natural supplement, it's called network pharmacology. So what that means is it actually affects a broader range of receptors in your body versus when you're taking prescription medication, it's a very narrow and linear effect. You take your blood pressure medications, your blood pressure goes down. Boom. Right? If you take too much, the blood pressure bottoms out. Same
Mhm.
thing with diabetes meds. Same thing with your seizure meds. You take too much, you get your rash, you might feel even more depressed, you might feel foggy and sedated. With herbal medicine, it's much more subtle. So you take it, maybe you'll feel better in like a week or two. You're like, oh, I feel like my joints move a little bit better, or I feel like I'm sleeping a little bit better, but I'm not completely sedated. That's how herbal medicine works.
Oh, wow. Okay,
Yeah.
I didn't know that. I should tell
Hmm.
everybody that. Because I know a lot of people, obviously, in addition to my mother, that take alternatives. This was wonderful, Dr. Chin. You're lovely.